What if I told you there is one thing, one simple thing, you can do every single day that meta-analyses of over 1 million people have linked to a measurable reduction in cancer risk after 50? No expensive supplements, no complicated diet, no equipment, no gym membership, just one habit, 30 minutes, already in your body's natural design. The American Cancer Society has been quietly publishing research on this exact habit for over 15 years. The National Cancer Institute has pooled data from 26 separate studies confirming the same finding. And yet, when I ask my patients over 50 whether their doctor ever explained this to them, almost no one says yes. Because there's no 15-minute office visit long enough to explain the biology, there's no pharmaceutical company funding educational campaigns about it, and there's no profit margin in telling people something they can do for free. Today, I'm going to walk you through exactly what this habit is, what the research actually shows, the 7 specific mechanisms by which it supports your body's cancer defenses, and the 30-day protocol to begin tonight. This applies whether you're a man or a woman, whether you're 52 or 78, whether you're already healthy or recovering from something. The mechanisms work the same way in every adult body. Stay with me through the next 20 minutes, because by the end, you'll know exactly why this works and exactly how to start. I'm Dr. Ravtani. I've been practicing family medicine for 20 years. In those 2 decades, I've sat across from hundreds of patients who received cancer diagnoses, and I've sat across from thousands more who came to me anxious about cancer, about what happened to a parent, a sibling, a friend, worried whether something was already growing inside them, wondering what they could possibly do to lower their odds. The conversation I've wished I had more time for in those visits is the one I'm about to have with you today. Because here's the truth. Cancer is influenced by hundreds of factors. Some you can't control: genetics, age, environmental exposures from decades ago. But a meaningful portion of your cancer risk is influenced by daily habits. And among those daily habits, one stands out in the research more consistently than any other. If this video helps you, please subscribe. I make videos like this every Tuesday and Friday at 6 in the morning Eastern Time. Each one breaks down a piece of senior health that gets glossed over in the typical 15-minute visit. Subscribe, and let's get into this. Before we go further, I need to be very clear about something. What I'm sharing today supports your cancer screening. It does not replace it. If your doctor has recommended a colonoscopy, a mammogram, a low-dose CT for lung screening, a PSA discussion, a skin check, or any other age-appropriate screening, please go. The single most powerful tool we have against cancer is catching it early. Habits help your body's defenses. Screening catches what those defenses miss. Talk to your doctor about your specific screening schedule. Talk to your doctor before starting any new exercise routine, especially if you have heart issues, joint problems, or any chronic conditions. Talk to your doctor. Now, let's get to the science. Comment below, drop your country and your age. Just the decade is fine. 50s, 60s, 70s. I read every comment in the first 24 hours, and it tells me who I'm reaching. Before I tell you what the habit is, you need to understand why daily habits influence cancer at all. Because once you understand the biology, the habit itself is going to make complete sense. Cancer doesn't appear overnight. Most cancers develop over 10, 15, sometimes 25 years before any symptom shows up. During that long invisible window, 3 biological systems are working continuously to either prevent cancer cells from forming, identify them when they do, and destroy them before they multiply. System 1. Your inflammation balance. Chronic low-grade inflammation in your body acts like a constant low-level wildfire. Cells exposed to it for years accumulate genetic damage. The damage builds up. Some of that damage eventually crosses a threshold where a cell stops behaving normally. When you reduce chronic inflammation, you reduce the rate at which that damage accumulates. System 2. Your immune surveillance. Your immune system contains specialized cells called natural killer cells. Their job is to patrol your body and identify cells that have started behaving abnormally. When they find one, they destroy it. After 50, this surveillance system naturally weakens. Anything that strengthens it pays dividends. System 3, your hormone metabolism. Several common cancers, breast, prostate, colorectal, endometrial, certain liver cancers, are influenced by levels of insulin, estrogen, testosterone, and growth hormones circulating in your bloodstream. When those levels stay balanced, cancer cells get less of the fuel they need to multiply. So you have inflammation, immune surveillance, and hormone metabolism. 3 systems. All 3 are influenced, measurably, demonstrably, by daily habits. And one daily habit affects all 3 at the same time. That habit is what we're talking about for the rest of this video. The habit is 30 minutes of brisk walking, or equivalent moderate activity, every single day. That's it. I know. It sounds almost too simple. Patients hear that, and sometimes the disappointment is visible on their face. They were expecting something exotic, a specific supplement, a particular food, a new technology. Something that feels worthy of the threat. But I want you to listen to what the research actually says, because the simplicity is exactly what makes this so powerful. In 2019, the National Cancer Institute, working with researchers from Harvard and the American Cancer Society, published one of the largest analyses ever performed on physical activity and cancer risk. They pooled data from 12 separate studies covering more than 1.4 million adults. The finding was striking. Moderate physical activity, defined as the equivalent of brisk walking 30 minutes a day, 5 days a week, was associated with statistically meaningful lower risk across 13 different cancers: colon, breast, endometrial, kidney, liver, esophageal, bladder, stomach, lung, several others, 13 cancers, from one habit across more than 1 million people. Now here's the part that surprises my patients. The relationship is not linear. More activity is not proportionally better. The biggest reduction in risk happens between 0 activity and moderate activity. Going from a sedentary lifestyle to 30 minutes of brisk walking captures most of the benefit. Pushing beyond that, adding hours of intense exercise, adds smaller and smaller additional reductions. Think of it like watering a garden. The first inch of water transforms the soil. The second inch helps. The third inch helps a little. By the 5th inch, you're just creating runoff. Your body's anti-cancer biology responds the same way. The first 30 minutes of moderate movement does most of the work. According to the American Cancer Society's 2020 Nutrition and Physical Activity Guidelines, the goal for adults over 50 is at least 150 to 300 minutes of moderate intensity activity per week. 30 minutes a day, 5 to 7 days a week, hits that target precisely. The question to take from this section: are you currently getting 30 minutes of brisk walking 5 days a week? If not, that's where we start. Now let's go deeper into the first of the 3 biological systems: inflammation. I told you earlier that chronic low-grade inflammation is like a slow wildfire in your tissues. Walking puts that fire out, or at least turns it down significantly. Let me tell you about Robert. Robert is 64, a retired postal worker from Minnesota. He came to me 3 years ago with blood work showing chronically elevated inflammation markers. A marker called high-sensitivity C-reactive protein, HSCRP for short, was running at 4.8. Normal is under 1. He had no infection, no injury. His body was just running hot inside. We talked about all the usual things: diet, sleep, stress. He was already doing reasonably well in those areas. The one thing he wasn't doing was moving consistently. He walked a little, sometimes, when the weather was nice. I asked him to commit to 30 minutes of brisk walking, 6 days a week, no exceptions. 12 weeks later, his HSCRP was down to 1.6. By 6 months, it was 0.9. Most patients tell me they assume inflammation comes from food, and diet matters. But movement matters more for chronic inflammation than almost any single dietary change. Here's what's actually happening. When you contract large muscle groups during walking, your quads, your glutes, your calves, those muscles release messenger proteins called myokines. Myokines circulate through your bloodstream and signal your immune system to lower the inflammatory response. The science journal Nature published a landmark paper in 2019 showing that one of these myokines, interleukin-6, released from working muscle, has the opposite effect of interleukin-6 released from inflamed tissue. Same molecule, different source, different effect. Imagine your immune system has a thermostat. When you sit all day, the thermostat creeps up. Walking is the hand that resets it back down to its proper setting. Every day you walk, you press the reset. According to research published in the journal Cancer Prevention Research, sustained moderate exercise reduces multiple inflammatory markers associated with cancer development, including the same hsCRP we measured in Robert. The question to ask your doctor: could we check my hsCRP and other inflammatory markers at my next visit, then recheck them after 12 weeks of consistent walking? Aspect 3. Insulin sensitivity. This is the one most people don't connect to cancer at all, but the connection is real, and it matters more after 50 than at any earlier point in life. Insulin is the hormone your pancreas produces to move glucose out of your bloodstream and into your cells. When you're insulin sensitive, your body uses small amounts of insulin to manage blood sugar effectively. When you become insulin resistant, which happens to many adults over 50, your body produces more and more insulin to do the same job. Levels of insulin in your blood rise. Here's the cancer connection. Insulin is a growth signal. It tells cells to multiply. In your healthy cells, this is exactly what should happen. In cells that have already developed early genetic damage, those same growth signals can accelerate them down a problematic path. Several major cancers, including breast, colorectal, pancreatic, and endometrial, show stronger growth in environments with chronically elevated insulin. A meta-analysis published in JAMA Internal Medicine analyzing data from over 500,000 participants found that markers of insulin resistance were associated with elevated risk of multiple cancer types. The relationship was independent of weight. Even at normal body weight, high insulin levels carried risk. Walking changes this. When you walk briskly for 30 minutes, your muscles pull glucose out of your bloodstream without needing much insulin to do it. Your insulin levels drop. Your insulin sensitivity improves. Studies using continuous glucose monitors show that a single 30-minute walk after a meal can lower post-meal glucose by 30 to 50 points, with proportional drops in insulin. Think of insulin like a megaphone shouting at your cells to grow. When insulin is low, the shouting stops. The cells calm down. Anything in your body that benefits from less growth signaling, including cells that shouldn't be growing, gets less encouragement. The question to discuss with your doctor: could we check my fasting insulin level along with my fasting glucose? It's a more sensitive marker than glucose alone. Wait, quick interruption. If this is making sense to you so far, please type the number 2 in the comments. It tells YouTube to show this video to more people who might need it. Just the number 2. Thank you. Back to the science. Aspect 4. Immune surveillance. This is the one that fascinates me most as a clinician, because what walking does to your immune system happens in real time, within minutes of starting your walk. Let me tell you about Linda. Linda is 57, a retired nurse from Oregon. She came to me after her sister was diagnosed with breast cancer. Linda was understandably anxious. She wanted to know what she could control. We talked about screening, we talked about diet, and then we talked about her natural killer cells. Most people have never heard of natural killer cells. They're a specialized type of white blood cell, sometimes called NK cells, and their job is to patrol your body looking for cells that have begun behaving abnormally, including cells in the very early stages of becoming cancer. When NK cells find one, they release small protein packets that destroy the suspicious cell. After 50, NK cell activity gradually declines. Studies show NK function in 70-year-olds can be roughly 50% of what it was at 30. That decline is one reason cancer risk rises with age. Here's where walking does something remarkable. Research from the University of Bath, published in the Journal of Applied Physiology, demonstrated that a single bout of moderate exercise, like a 30-minute brisk walk, produces a temporary surge of NK cells into circulation. After the walk, those NK cells redistribute throughout your tissues and survey for abnormal cells. The surveillance gets a temporary boost every time you walk. Walk consistently for months, and that boost becomes the new baseline. Imagine your immune system has security guards patrolling your body. Most of the time, a percentage of them are off-duty. Walking is the alarm bell that calls them all in for a shift. The more shifts they work, the more thoroughly your tissues get patrolled. According to research published in the journal Frontiers in Immunology, regular moderate exercise is associated with measurably enhanced immune surveillance, particularly in adults over 50 whose immune function has begun to decline. The question to discuss with your doctor: are there any inflammatory or immune markers worth checking that would give me a baseline to track how my body is responding to lifestyle changes? Aspect 5. Hormonal balance. For both men and women over 50, certain cancers are influenced by levels of circulating hormones: estrogen, testosterone, insulin-like growth factor, cortisol. When these hormones are balanced and within healthy ranges, the cellular environment in your body is less hospitable to cancer cell development. For women, particularly postmenopausal women, research has consistently shown a relationship between higher levels of circulating estrogen produced by fat tissue and risk of breast and endometrial cancer. Walking changes this. Studies show consistent, moderate exercise reduces circulating estrogen levels in postmenopausal women by lowering body fat percentage and changing how estrogen is metabolized in the liver. For men, testosterone metabolism matters for prostate cancer biology. Walking influences how testosterone is converted into other hormones, including dihydrotestosterone, in ways that research suggests are protective. For both men and women, insulin-like growth factor 1, called IGF-1, is a powerful growth signal that walking helps regulate. Chronically elevated IGF-1 has been associated with increased risk of several cancers in epidemiological studies. Let me tell you about Susan and her husband David, both in their early 60s, retired educators from North Carolina. They came in together after Susan's bone density scan showed early thinning. We talked about a comprehensive plan: vitamin D, calcium-rich foods, vitamin K2, and movement. They committed to walking together every evening for 30 minutes. When they came back at 6 months, both of their blood work looked different. Susan's estrogen-related markers had moved toward healthier levels. David's testosterone to estrogen ratio had improved. Neither had taken any new medications. They had just walked together every evening, 6 days a week. According to the American Cancer Society's 2020 guidelines, regular physical activity is one of the most evidence-supported lifestyle interventions for hormone-related cancer risk reduction in both men and women. The question to discuss with your doctor: could we check my hormone panel in a year after I've established a consistent walking habit to see how my numbers have changed? Aspect 6. When does the time of day matter? This is one of the most common questions I get, and the honest answer is, the best time to walk is the time you'll actually do it consistently. Consistency beats optimization every single day. But if you have flexibility about when, recent research suggests some interesting nuances. Morning walks, especially within an hour of sunrise, appear to have particular benefits for circadian rhythm regulation. Your body has internal clocks that influence hormone release, immune function, and inflammatory cycles. Morning light combined with morning movement strongly anchors those clocks. Studies suggest this circadian anchoring may have anti-cancer effects through better hormone timing and improved sleep quality at night. Post-meal walks, particularly after dinner, are exceptional for blood sugar and insulin management. Even 10 minutes of walking after a meal blunts the glucose spike. Continuous glucose monitor research shows the benefits are most pronounced for the meal eaten before the walk. Late afternoon walks, between 3 and 6 p.m., coincide with peak natural body temperature and physical performance. For some people, this is when walking feels easiest and most sustainable. What about late evening? Walking right before bed is generally fine for most people, but vigorous walking within an hour of sleep can disrupt sleep onset for some. Gentle walking is better than nothing, but if it's going to interfere with sleep, shift earlier. A 30-minute walk performed at any time of day captures most of the cancer-related benefits we've discussed. Don't let perfect timing become the enemy of consistent action. According to research published in the journal Sleep, regular morning physical activity combined with morning light exposure produces the strongest circadian benefits. But the same study confirmed that timing matters far less than total weekly movement. The question to discuss with your doctor: given my schedule and my health profile, is there any time of day that would be particularly beneficial, or any time I should avoid, for my daily walk? Wait, if you've made it this far and you're getting value, please type the number 4 in the comments. Just the number. It tells me you're still with me. Thank you. Aspect 7. The compound effect. Walking by itself is powerful, but walking combined with 3 or 4 other simple habits creates a much larger protective effect than the sum of the parts. The ACS continues to publish research on what they call lifestyle bundles, combinations of habits that work synergistically. Their analysis of over 500,000 adults found that adults who maintained 4 core habits, regular moderate physical activity, healthy body weight, a diet rich in vegetables and whole foods, and not smoking, had cancer rates roughly 30% lower than adults who maintained none. Let me give you the 4-habit bundle that works alongside your daily walk. First, sleep duration. Aim for 7 to 8 hours of quality sleep nightly. Sleep is when your body performs cellular repair, when your immune system consolidates its memory, and when growth hormone supports tissue maintenance. Combining walking with consistent sleep amplifies the immune benefits substantially. Second, colorful plant foods. Aim for at least 5 different colors of vegetables and fruits across your day. Different colors carry different protective compounds: flavonoids in blue and purple, carotenoids in orange and red, glucosinolates in green cruciferous vegetables. Walking improves how efficiently your body uses these compounds. Third, limit alcohol. Even moderate alcohol intake is associated with elevated risk for several cancers, including breast, colorectal, and liver. The ACS recommends limiting alcohol or avoiding it entirely. If you do drink, walking does not cancel that effect. But a non-drinking adult who walks captures more benefit than a drinking adult who walks. Fourth, manage chronic stress. Chronic stress elevates cortisol, which suppresses immune function. Walking is itself a stress reduction tool. It lowers cortisol within minutes, but adding meditation, prayer, time in nature, or social connection further amplifies the benefit. Imagine walking is the foundation of a house. Sleep is the walls. Food is the roof. Stress management is the insulation. Each is good alone. Together, they create something none of them can build alone. According to the American Institute for Cancer Research, the combination of these 4 habits represents the highest impact, most evidence-supported lifestyle approach to cancer risk reduction available today. I want to address a few questions I always get when I talk about this with patients. What if I have arthritis or joint pain? Walking is one of the most joint-friendly forms of movement. If pain limits regular walking, talk to your doctor about water walking, stationary cycling, or recumbent options. The biological mechanisms we discussed don't require running or jumping. They require sustained moderate movement of large muscle groups. Many forms qualify. What if I'm short on time? Research published in the British Journal of Sports Medicine showed that breaking 30 minutes into 3 10-minute walks throughout the day captures most of the benefits of one continuous 30-minute walk. If you can't do 30 minutes at once, do 3 10s. What about indoors versus outdoors? Outdoor walking has small additional benefits from sunlight, fresh air, and nature exposure. But indoor walking on a treadmill, around your home, or at a mall is still highly effective. Don't skip the walk because the weather isn't perfect. What if I'm overweight? Walking is more, not less, important for adults carrying extra weight. Body fat tissue produces inflammatory signals and influences hormone metabolism. Walking helps shift this even before significant weight loss occurs. Don't wait until you've lost weight to start walking. Start walking, and the rest follows over time. What about high-intensity exercise? It has benefits, particularly for cardiovascular fitness. But for cancer-specific risk reduction, the research consistently shows that moderate sustained activity captures most of the benefit with much lower injury risk in adults over 50. If you enjoy higher intensity work and your doctor approves, that's wonderful. If you don't, you're not missing out by sticking to brisk walking. The bottom line, there's a version of this habit available to almost every body. Find yours. Let me share 3 patient stories to make this real. Margaret, 68, retired teacher from rural Vermont. Family history of colon cancer. Both her mother and her aunt had been diagnosed in their 70s. Margaret was anxious. She'd done her colonoscopy on schedule, but she wanted to know what else she could do. We started with 30 minutes of walking, 6 mornings a week. She took her dog with her. The dog became the accountability partner. 2 years in, her blood work shows excellent inflammatory markers, her weight has stabilized, and her annual visits have become genuinely uneventful. She tells me the walk became the favorite part of her day. Henry, 71, retired electrician from Texas, diagnosed with prostate cancer at 68, treated successfully, in remission. He came to me asking what to do to reduce recurrence risk. We discussed walking. He committed to 45 minutes after dinner with his wife. 3 years later, his PSA has remained excellent, he's lost 12 pounds, his metabolic numbers improved, and his oncologist has reduced his follow-up frequency. The walking didn't cure him, his medical treatment did, but the walking has helped his body maintain remission. Elena, 56, real estate agent from California, strong family history of breast cancer, premenopausal. Genetic testing showed no major hereditary mutations, but anxiety remained. She built her walking habit around her work, taking listing calls while walking the neighborhood. 15 months in, her metabolic and inflammatory markers had measurably improved, her stress levels were lower, and her sense of agency had transformed. She told me she stopped feeling like cancer was something happening to her, and started feeling like her body was actively defending her every day. These 3 stories represent thousands like them. Different ages, different cancers in family history, different starting points, same daily habit, same biological mechanisms working in the background of every step. Now I'm going to give you the practical part, the 30-day protocol to begin tonight. Days 1 through 3. Start small, just walk. 10 minutes is enough. Out the front door, around the block, back inside. Don't worry about pace, distance, or anything else. The goal of these 3 days is to prove to your brain that this is now a thing you do. Days 4 through 7. Extend to 20 minutes. Walk at a pace where you can talk in full sentences but feel slightly out of breath. This is the moderate intensity zone. Not gentle strolling, not breathless, brisk. Days 8 through 14. Reach 30 minutes, 6 days a week. Pick one rest day if you want. Sunday is fine for many. Use a phone timer. Set the same time of day. Treat it like an appointment with yourself. Days 15 through 21. Begin pairing the walk with another habit you already do. Walking after breakfast. Walking after dinner. Walking while listening to a specific podcast or audiobook. Habit pairing is one of the most powerful tools we have for making something stick. Your brain needs cues to repeat behavior. Days 22 through 30. Add one variation per week, a different route, a slightly faster pace one day, a walking partner one day. Variation keeps the brain engaged and prevents the mental drift that ends most habits at the 6-week mark. End of day 30. Sit down with your calendar and look at how many days you actually walked. If it's 20 or more out of 30, congratulations, you've installed the habit. The neural pathways are now in place. From here, It becomes much easier to maintain. Keep a simple log. Date, duration, how you felt. 3 lines per day. After 30 days, you'll have a record of your transformation that will be its own reward. Talk to your doctor at your next visit. Show them your log. Ask whether any of your blood work should be rechecked. Ask whether your screening schedule should be adjusted. The data you bring makes your doctor's job easier and your visit more productive. Here's what I want you to take from this video. Cancer is influenced by hundreds of factors, many you can't control. But the daily choices you make about how you move your body, those are within your control. Every single day. 30 minutes, 1 habit, 3 biological systems supported. 13 cancer types with research-backed associations. Hundreds of thousands of adults studied over decades. The evidence is as solid as evidence in medicine ever gets. Move daily, screen regularly, age well. That's the formula. It's not exotic, it's not expensive, it's not complicated, and it works. If your doctor has recommended cancer screening, please go. If you're due for a colonoscopy, a mammogram, a low-dose CT, a skin check, a PSA discussion, please make the appointment this week. Habits help your body's defenses. Screening catches what those defenses miss. Both matter. If this video gave you something new today, please subscribe. I post videos like this every Tuesday and Friday at 6 a.m. Eastern. Each one is built to give you what your 15-minute appointment doesn't have time for. Please share this video with someone you love. A spouse, a sibling, a friend, a neighbor. Send it directly. The algorithm doesn't push videos like this to seniors automatically. It shows them to people whose family members shared with them. And in the comments, tell me, are you going to commit to 30 days of walking? Yes or no? That's all. One word. Yes or no. I read every reply in the first day. Take care of yourselves. Take care of those bodies that have carried you this far. They deserve 30 minutes a day. Move daily. Screen regularly. Age well. I'll see you in the next video.